Hey, it's Dr. Nodelman here at District Foot and Ankle. Today I'd like to talk about cortisone injections and some of the overlooked risks associated with this modality that can actually be effective for a variety of foot and ankle conditions. The most common examples would be plantar fasciitis and perhaps injecting a joint that has arthritis. All medications do have risks associated with them, including cortisone, and here are some of the overlooked risks that aren't commonly discussed. Something that can happen about 5% of the time would be a post-injection flare reaction. This is when the body produces an inflammatory response to the cortisone itself. Typically, pain will be increased. There can be some redness and warmth to the area that's injected as well. Typically, with this reaction, you can still have benefit from the cortisone, but the flare needs to subside. And the best way to achieve this is just to either let it happen on its own, or it can be treated with anti-inflammatories by mouth, or one could consider a warm pack applied to the area that's symptomatic. Another reaction that can sometimes be seen more commonly in women would be facial flushing. Usually this occurs within hours after the injection is performed. It does not imply that there is an allergic reaction, and sometimes it can last a few days, but usually it goes away on its own without any active intervention. One of the more devastating reactions that can occur with multiple cortisone injections would be atrophy or thinning of the fat pad on the bottom of the foot. So there's two common locations on the bottom of the foot where you have more fat pad, that'd be in the ball of the foot and also underneath the heel. The fat pad serves to cushion the area and provide shock absorption for when you're walking and running and doing the activities that you like to do. So one issue with multiple injections would be atrophy or thinning of the fat pad, and when this occurs, you lose that cushioning that you need to cushion the bones underneath, and this can be really difficult to manage. This can be extremely painful as well. Cortisone can actually lead to a process known as chondrotoxicity. That means that it can be damaging to the cartilage of a joint. Cartilage is the white, shimmering tissue that surrounds a joint to give it that nice gliding surface. Cortisone injected into a joint can lead to further damage and deterioration of a joint. So that's why typically in earlier stages of arthritis, I typically do not recommend a cortisone injection into a joint, because you could potentially make the arthritis advance a lot faster. I will, however, typically recommend a corticosteroid injection for someone that has more moderate to advanced stages of arthritis that need a quick fix, some relief, and basically will buy some time in preparation for a possible surgical procedure, or perhaps the patient may not be a good candidate for surgery, and this would be a good solution to keep their symptoms at bay, and the injections can be performed on a periodic basis. Some other considerations for corticosteroid injections would be in patients with diabetes. Steroids, either by mouth or in injectable form, it can cause a temporary increase in sugar levels, which, depending on the adequacy of diabetes control, can send sugars through the roof. So this is something that should be highly considered before an injection is offered or performed. Another potential risk could be bleeding in patients that are on anticoagulation therapy or blood thinners. An example of a reason to be on a blood thinner would be because of atrial fibrillation. And it's possible that some increased bleeding could potentially be seen because of the trauma from the injection itself, and not necessarily because of the steroid. In summary, cortisone injections can be really helpful in very specific circumstances. Typically they are band-aids. They do not cure fasciitis. They do not cure arthritis, but can be very effective modalities for decreasing the pain associated with inflammation. It's important to have a thorough discussion with your provider to make sure you are a good candidate for a corticosteroid injection and to discuss the benefits, risks, and alternative therapies that are available, because the injection may not be the safest option for you.